Well, I was diagnosed in November of '08 with a rare appendix cancer. That when it was found was already metastatic, stage 4, grade 3. I did have surgery in November of '08 at Mayo Clinic, and they were able to remove the tumors that were in several spots. And I did have 12 rounds of chemo at Luther Middleford last summer, and then a CAT scan and some other signs in February of this year showed that the cancer was back, and it had spread into the whole peritoneal cavity, and was considered terminal, basically. So I'm on palliative chemotherapy now again at Luther Middleford. So I've had another 7 rounds, so 19 rounds all told of chemotherapy. So doing pretty good, actually. I think what I think about how I could be doing. It's a terrible shock. It's devastating, it's decimating, and it'll knock your world apart. And that's just part of the reality of it. And hopefully you won't be all alone or feel all alone when you do get bad news. And really, the medical world has come a long way, and they keep learning new things. And so there might be some things that at a minimum can help you be more comfortable. So if you're feeling all alone, you don't have to be all alone. Just reach out. The staff are wonderful people. And it was good for Mary to be able to explain more how palliative care approaches pain management, and just how sort of the least interventionist way to handle different complications or symptoms that can come from the chemo or from the cancer itself, and giving advice on how to word things when you're talking to the doctors. Giving you the words, helping you best know what you really want to say, and finding the way that will be most receptive to a medical doctor's ears, let's say. I would say the diplomacy of it all. You know, pain is a definite issue with cancer. The words are kind of synonymous. And I think people try to balance pain management, but also being alert as best as possible and not constipated. So you got this whole balancing act, and I have appreciated palliative care's help in different dietary things that a person can do in terms of the whole constipation business that pain pills can cause, or suggest other pain pills that maybe wouldn't be as constipating that I could maybe ask the doctor about. And even also with pain management, helping me understand maybe some things I forgot to ask the doctor, to understand how pain medicine works, or the value of having a regular pain a schedule so you're not peeking into the pain, well, there's just a lot to learn with all of this, and I think you feel like there's no stupid question. When I heard once again about the Do Not Resuscitate bracelets, I thought, well, it's time, because I wouldn't want to be in a situation knowing that I'm basically terminal, where my daughters, out of good intentions and just scared to death, said, sure, do this, do that. I didn't want that at all. So I felt very relieved the day this bracelet came in the mail. And I could end up in the hospital, of course. And Mary explained some of the ways, if you have some partial bowel obstructions, that there are some palliative care treatments that can happen in a hospital setting, or for a while try some things to see if it makes any difference in your daily quality. So that was good for me too, because I don't want to be so black and white that I would shortchange something that could really help. It's just good that there's a palliative care people that can be a translator and a link, and also a link with the family, because in my own work as a social worker, sometimes families are the ones that push for more interventions, and out of love, of course, and out of fear. But I've got all my power of attorney for healthcare written in great detail. I've got my Do Not Resuscitate bracelet. Yes, well, anytime you've got a serious illness, I think the realm of spirituality is very, very important, and I think it's wonderful that there are chaplains that are available to come and be with people. And Sister Margaret has actually been very helpful in raising questions for me to think about, or again, ways to find the right language to ask the questions of the doctor, helping me sort out some of my fears and my concerns about my daughters, concerns about my family. And, you know, again, they've seen so much in their time there at Luther that they have a way to help give you permission to talk about some of the deeper things that you really don't think you can talk about with your family, but are definitely on your mind. So it's another safe haven. And you can be candid, and they've heard it before. They're not gonna, you know, fall apart on you, you know. And they're just so compassionate. And it's a very healing thing also to have prayers said on your behalf, and in a way that's sensitive to what your faith beliefs are. And very compassionate. I always feel so much better after the chaplains are coming in and visiting me and doing some healing spirituality. I always feel so much better.